Next session, I'm going to call on the stage Nora Rodriguez, who's here, and Lindstrand, my boss, Olamide, Karan, Sagar, Kelly, of course, and Daniel, Salas from PAHO. The session will be facilitated by Nora Rodriguez from PAHO. Nora, over to you.
Thank you, Solo. Buenas tardes. Good afternoon. Bienvenidos a las Américas. Welcome to the Americas. Welcome to Panama City. We are very pleased to welcome you to the 17th conference of the TechNet here in Panama. There are important lessons learned from mitigation of the COVID-19 pandemic. But now we must need to assure that national immunization programs that leave no one behind. Partners and governments have two challenges. One, recuperating vaccination coverages because of the impact of the COVID-19 pandemic had on the demand for routine childhood vaccinations. And second, the introduction of new vaccines in the pipeline. Governments should allocate the required resources for supporting the two challenges. Therefore, we have a panel to address the immunization programs that leave no one behind. So we have the panelists in this session. Anne Lindstrand is the unit head of the immunization programs, the session program immunization and WHO headquarters Geneva. Olamide Folorunso, health specialist, UNICEF program group. Karan Sagar, head comprehensive vaccine management, Gavi. Kelly Hamblin, senior program officer, immunization, Bill and Melinda Gates Foundation. And Daniel Salas, executive manager, comprehensive immunization program in PAHO. So I would like to invite to the podium Anne Lindstrand, unit head essential program of the immunization, WHO headquarters Geneva.
Thank you, Nora. Thank you, Nora. And thank you for letting me speak to you in just 10 minutes, trying to frame this conference. We are using IA 2030 as kind of a backbone to the TechNet conference. So I'll very quickly go through a little bit about the framework, IA 2030, the present, and a little bit about the future. So IA 2030 is a global vision and strategy for immunization worldwide. It is framed with a vision called a world where everyone, everywhere, at every age, fully benefit from vaccines for good health and well-being. And it has three strong and ambitious impact goals, which are the reducing mortality and morbidity from vaccine-preventable diseases throughout life course. And then the equity goal, which actually is the name of the TechNet conference, right? Leave no one behind by increasing equitable access and use of new and existing vaccines. And finally, something that shifted with this global strategy in immunization was this strong emphasis on systems. So ensuring good health and well-being for everyone by strengthening immunization within primary healthcare. So this new strategy, or it has a few years now, was built with thousands. Probably all of you in this hall had some kind of an input into building our immunization strategy for the world. It was built in 2019 and 20, and it was endorsed in August of 2020 by all member states of WHA. A year later, we came and got also endorsed the partnership framework for action, which is the monitoring, evaluation, and also all the governance structures around IA 2030. The year later, there was the first progress report, and this was all through the pandemic, right? And in the World Health Assembly, or in April, actually, in the World Immunization Week in April 2023, we, the partnership, launched the big catch-up to respond to the pandemic impact on immunization that I'll come back to. So what is this Immunization Agenda 2030? It's focused around 7 strategic priorities. At the heart, in the center, are the immunization, the primary healthcare and immunization services. And then you have 6 specific strategic priorities, which are commitment and demand, the coverage and equity, the life course and integration, outbreaks and emergencies, supply and sustainability, and research and innovation. And I think maybe even more importantly, the core principles that lie behind everything that we need to do to advance immunization, having people-centered services, country-owned, partnership-based, and data-guided. And where are we then? Well, here are the setup of the M&E, you can say. So of the 3 impact goals, to prevent disease, to promote equity, and to build strong immunization systems, we have 7 targets, and they are very ambitious. The 50 million future deaths averted, to actually achieve the endorsed goals for control, elimination, and eradication of vaccine preventable diseases, decrease large disruptive outbreaks, 50% reduction of zero-dose children by 2030, 500 introductions, and 90% coverage in the SDG 3 indicator antigens, vaccines, and improve universal health coverage. So where are we? At SAGE, just a few weeks ago, the technical progress report gave us an update on where we were, and we are not on track. Not surprisingly, we have all lived through the pandemic years. So on the future deaths averted, we actually, with the decrease in coverage, we estimate that about 860,000 additional future deaths will be done unless we act now and stop those immunity gaps created by the pandemic impact. We're doing very slow progress on the elimination goals. And then on many of the outbreaks, we're also off track. So at SAGE, there was an ambitious agenda discussed on what do we need to do now. And we agreed, and in the technical progress report across all the partners, that these topics, the 6 topics here, are the ones that we really need to pay attention to. Catch up and strengthening, promoting equity, regaining control of measles, making the case for investment, domestic investment in vaccination, accelerate new vaccine introduction, and advanced vaccination in adolescents. So all of those are now top priority for the partnership around IA 2030 and the development in the technical working groups that are working, really thinking about how can we deliver, how can we advance these topics. And I know many of them will be discussed during this couple of days we have together. So let's see on the present. In July every year, WUNIC is released, as you know, the global coverage data collected from every country of the world. So in this year's, we got the 2022 data, and we got a little bit of a relief. If you looked at the global level, the DTP3 has increased and the zero-dose number have decreased. The coverage have increased, the zero-dose numbers have decreased. So from 18.1 million zero-dose children in 2021, we're now at 14.3. But we're not totally back to pre-pandemic levels, even though this is a good advancement. If you then look, and then parts of that, what we're worried about, if you just do a little bit details, these are 4 other slides that are key for our conference today. On the measles side, we're not at the same place of recovery as we've been with the DTP3. Africa is lagging behind. The decrease in zero-dose children are actually represented very much by a few larger countries, and the progress recovery is very unequal. You also see on the low-income countries, the top right one for you, you can see that the low-income countries, the red line is lagging behind. So that the low-income countries are not experiencing the same recovery as the higher and middle-income countries. And even worse so, on measles, low-income countries are still decreasing in coverage. And on the lower left-hand side, you see an increase in the dropout rate between DTP1 and DTP3, but also between DTP3 and MCV1. So increasing dropout rates. Children do not get protected, fully protected. And even if you go even further, the progress is unequal. So on the top left, the bottom right here, you can see that the dropout is scarce and different. This is, of course, feeding what we're seeing, right? We are seeing outbreaks of measles increasing. More than 40 countries experienced large and disruptive measles outbreaks in the last 12 months. We are also facing diphtheria, large outbreaks. In Nigeria right now, the numbers are actually outdated. It's more than 11,000 diphtheria cases in Nigeria that are being responded to right now. In Guinea as well. So the big catch-up is needed more than ever before. The catch-up of missed children, restore coverage rates up to the 2019 data and beyond, but also strengthening immunization programs. And we want to do this mindfully by building up a capacity to continuously catch up children, not just a one-off. There are, however, good limelights. We have on HPV, for example, there's been, apart from big catch-up, HPV is also one of the must-wins with the Gavi collaboration in the Gavi Alliance. And we can see that in HPV, 26 countries have now moved to a one-dose schedule, much more simple to administer in programs and more cheap. We have 135 countries that have introduced HPV, and many of the big countries are right now on their way to introducing. Bangladesh, Indonesia, Nigeria this month, and Pakistan have also decided that they will introduce. So we'll see a huge, big increase in coverage also for HPV around the world. And actually, HPV was one of the antigens there where we really saw an increase in coverage in the 2022 data. So looking ahead, 3 slides. On the malaria, I am totally excited that this deadly disease, 468,000 child lives per year, can now have an additional arm in fighting this deadly disease. So you know that we've had the pilot studies in 3 countries, and we've learned from those countries in Africa, Ghana, Kenya, and Malawi, that the demand for these vaccines are fantastic. I was in Kenya and saw kind of how the perception of malaria switched from before and after vaccine pilot was introduced there. And even during the pandemic, with all the complexities, the coverage could be kept up. And we now see unprecedented interest by countries to apply for Gavi money to get funded for introduction of the malaria vaccines. And with this, the good news that SAGE introduced the policy recommendation of the second malaria vaccine 2 weeks ago, and that supplies doesn't seem to be a problem any longer. So I'm totally excited. It's going to be a game changer. A second game changer is this one, that the first clinical proof of concept of measles rubella microarray patches in Gambian children came a few months ago. And this is absolutely extraordinary. It has the potential to dramatically improve equitable coverage, right? And also reduce carbon imprint with easing delivery, less cold chain, but also minimizing the environmental waste. And I also wanted to end with kind of expanding and thinking of immunization as a life course instrument of public health. We had these vaccines from the beginning. We had COVID. We have new vaccines coming in. I am hoping that we're going to very soon see all countries moving and having decided their adult immunization schedules for all ages, not just the child's EPI schedule, but having on the wall of every primary healthcare also an adopted adult immunization schedule, because we need to plan for it with the new vaccines, not the least the fantastic TB promising candidates that are on the way. Finally, just to say, EPI turns 50 next year, 2024. And I'm hoping that we all, as immunization partners, can celebrate this in a strong and exciting way. This program has been a flagship in public health for 50 years. And if you can see on the left-hand side to what the vaccines we have today, and still going strong, as we heard from the introductory talks as well, the fantastic COVID vaccination was only possible because of the capacity that is built up in immunization around the world. Thank you so much.
Thank you, Anne. Now, I would like to invite to the podium Olamide Folorunso.
Thank you, Nora. And excited to present a few words on UNICEF's perspective on immunization and supply chains, and point you into some of the sessions that you would still go to in the next couple of days. So as a background, and I think Gary shared those words nicely, as UNICEF, the way we see the context of immunization is the fact that we don't see immunization as being isolated. We see a complex setting in countries that have a lot of the challenges of high zero-dose populations, high under-immunized children, and we see quite a complex setting and picture that needs a multi-sectoral approach that we'll go into. And this points that addresses that point quite clearly, as you would see in the countries that you would see with the most challenges with high number of zero-dose children with the blue box, also have intersections of major food crisis, high fragility, and also, like Anne just mentioned, occasional and quite consistent now measles outbreak. So we see a picture that is just not addressing one factor, but actually ensuring that we can respond to quite complex challenges. And that is informing our programming also. And I've talked about this slide, so I'll not go into it. It's important to understand that we are not back to pre-pandemic levels, and we should not rest on our oars. All efforts must be on deck to make sure that we continue to reach zero-dose and under-immunized children. So that has also encouraged us to revamp and revise our immunization roadmap. And that's the way we look at the approach that we take in addressing some of the challenges we see, which immunization supply chain is a critical component of. It's important that as we go into the next couple of days, we don't see immunization supply chain. And that's why, kudos to all the remarks we've heard, we should situate immunization supply chain in the broader context of immunization programs, broader health systems, and ensure that we reach over and beyond to meet the challenges that we face. In the next couple of years, the shift that we have seen and that we are taking as UNICEF includes redoubling on our zero-dose agenda, ensuring that we can put that at front and center of almost everything we do. Have innovative evidence-based approaches, as we've heard also from remarks. Innovations will be quite critical to ensuring that we can reach and these children, no matter where they are, with the multi-complexity of the context we have. Ensuring that we redouble on our middle-income countries approach, and understanding that even though the biggest problem sometimes may be in low-income countries, middle-income countries continue to be left behind in critical access to products and services. Ensuring that with the lessons, especially from COVID, we prepare countries to be ready to both have robust systems, but also to respond quickly in case of emergencies. So building resilience into every program we do will be quite critical. And as you know, UNICEF been for every child, ensuring that immunization is a strong lever and a foundation for primary health care services. So not just delivering one service, not just delivering one ample, but actually using that as a conduit for strengthening systems and delivering even more. Those are critical shifts that we would be taking. One vantage point that we have, and that, like Gary also mentioned, our regional director, is the multisectorality in our approach. And that would continue to be in the way we'll continue to collaborate with colleagues and partners all in the room to ensure that we deliver our product. So looking at not just the immunization, but looking at the whole public health systems, public systems, how do we strengthen together across these different areas that UNICEF supports countries. We mentioned earlier that building resilience will be important, and three key ways in which we will be hoping to do that is to strengthen coordination and governance in country, ensuring that we can be there supporting government when they bring together partners across the room from different sectors to make sure that they build their systems better. Supply and financing will be critical, ensuring that from forecasting to bring in procurement systems, strengthening it to make sure that we can predict, prepare, and appropriately plan for the needs, both the routine needs and the surge needs will be critical going forward. And also building that systems readiness and response resilience into every program we do will be critical. So in demonstrating this, we've already started taking some shifts and implementing some activities, and those are examples I'll just leave you with in the next couple of minutes, just to signpost you also to some of the sessions that we'll be holding. And also talked about this, catch up, restore, and strengthen. So I'm not going into a lot of details on that. We'll continue to collaborate with partners to make sure that this three-pronged approach are implemented successfully in all countries. But we continue to see that by deploying more foots on the ground, working embedded within government, but also supporting partners, coordinating it on the ground, having footprints in the remote settings in some countries, we are seeing shifts and decreases in stock in stockouts in countries. As you see at the national, regional, and district level, in countries where we've supported with these vaccine management specialists, we're seeing that with that support, we're seeing between 23 and 35% decrease in stockouts. And this continues to be a strong lever in country with Gavi's support to ensure that countries can appropriately respond to what would be causing stockouts and reduce that appropriately. As I've been mentioned earlier by some of the speakers, the cold chain equipment optimization platform has been a significant shift in the last 7 years in deploying new high-end equipment in countries, replacing sometimes very old and non-functional fridges. But we can't stop there. The next shift is around how we monitor performance of cold chain and the supply chain system through these refrigerators and through the devices that we're deploying in countries. And data integration of what comes from those cold chain equipment and temperature visibility will be extremely important to this in this new strategy that will be implemented in the next couple of years. And evidence-based decision-making will be central to that. Ensuring that the data is used for, not just collected, but used for action will be critical. Interoperability with existing systems and making sure that we can ensure that systems are robust to respond is critical to in this new strategy. and then make sure that being able to reinforce performance and expand appropriately across the supply chain systems will be critical. We see three key priorities in ensuring that we can deliver the temperature monitoring and consistent data systems and usage in countries. By one, focusing on the digital architecture and the whole digitalization of the ISC2 partners, as you've seen and heard earlier, will be reported to that. Appropriately financing the key drivers of making that shift will be important, but also investing in country in the change management that is required in going from not monitoring to monitoring and using the data for action would also be critical in moving that forward. We've seen, and not going into extreme details, the coaching inventory that we have that oftentimes we see in most countries are updated suboptimally will be critical to the shift we'll be making in the next couple of years. And that will be transitioning from just Excel-based tools where most countries that forms a large percentage of their coaching inventory to systems that are actually integrated into other logistics management systems in country will be important. And to do this, making sure that we have coaching inventory that are appropriately digitalized and rolling them out in countries, depending on the maturity of the systems in country, will be critical. And we're working with a lot of partners in the room to make sure that that happens in a seamless fashion. When we'll go into some of the sessions subsequently during this conference, and we'll see that distribution, and especially at the last mile, seems to be a major challenge for most countries. And investing in last mile distribution is one of the pieces we're taking forward through this initiative we're calling DRIVE, Direct Delivery of Routine Immunization Vaccines for Equity. And we're piloting in 5 countries, and that would built as a social enterprise in which we can contribute not just to supply chain, but program outcomes, but also create jobs at the for the local economy at the last mile stakeholders by engaging young persons, last mile institutions, stakeholders in the delivery of vaccines is an important shift we are also taking an example. There's a session after this that goes into more details on this, and we see that the carbon footprint analysis that we're seeing as some high-level recommendations in reducing our carbon footprint. You've heard from the speakers this morning, our climate change is extremely important on the shift we are making, both in operations and transport, and also appropriate waste management and disposal will be critical. But to leave you, we're also, as part of our primary health care approach, taking a whole shift in the way we set up health facilities and position them for success. And we have this health facility solar electrification agenda that we are working with support from Gavi to really push forward. And we've seen that the demand in countries is about 30,000 primary health care facilities that are required to be solarized. And we have the ambitious target of actually doing that by 2030. And we receive some support from Gavi to make sure that we can roll that out. And we'll be working with a lot of partners in the room to drive them forward. In a nutshell, as UNICEF, working from the context we're seeing, making those shifts in the way we work, especially centered around our multi-sectoral approach, will be critical in delivering our ambitions going forward in the next couple of years. And we're looking forward to working with everyone in the room to make that happen. Thank you.
Thank you, Olamide. Now, I would like to invite to the podium Karan, Sagar.
Thank you, Nora. And again, a very warm welcome to all of you. I know you have traveled from far and across to be here in the beautiful city of Panama. I hope you get some time to enjoy that as well. But today we're talking about immunization and leaving no one behind, and what role can supply chains really play in that endeavor. No product, no program. So definitely supply chains are the backbone of any program, including our immunization programs. And as Gavi, we are really focused on ensuring that our supply chains are providing the vaccines where they are needed. But what we are focusing on is equity, efficiency, and sustainability. And we talk about sustainability, it's not only financial sustainability, but also sustainability, which is looking at programs as well as the environmental sustainability. And to do that, which one is this? The big one. Yeah, sorry. So we, as an alliance, have developed the immunization supply chain strategy for 2021 to 2025, which we are now almost in the third year of implementing. And what does this strategy? What is this strategy? So the biggest thing that we want to address, as I said earlier, is the availability of vaccines at the last mile, so that the populations that we are catering to are able to receive the vaccines, and the immunization programs is able to deliver those vaccines. And this is a challenge across majority of our countries, but more so in the countries which have the highest numbers of zero dose. So that is the challenge that we are trying to address. And to do this in a holistic manner is what we have set ourselves to. Gavi had a strategy in 4.0 period as well, but what we have seen in 4.0 is that majority of our investments actually went into infrastructure. So 2/3 of supply chain investments were going into infrastructure, and rightfully so. But then leaving the other important aspects behind, and that really did not bring in the desired results and the impact that we wanted. So under 5.0, we have started taking a more holistic approach towards supply chain strengthening, which includes investment priority areas, which are 6 investment priority areas, as you would see here. And each of them is really contributing to our equity and efficiency goals. So first and foremost is data visibility and use. And when we speak about data visibility and use, data is underpinning to everything that we do. And for making that happen, Gavi is embarked on an ambitious journey along with other partners and donors in the space to digitize supply chain. And when we say digitize supply chain, it is just not rolling out LMIS systems in the countries, but also looking at how do we integrate these LMIS systems with the HIS2s of the world, or the remote temperature monitoring, or as has been spoken about through the cold chain inventory and performance monitoring of the cold chain. So this is an ambitious agenda that we have set for ourselves. We are looking at rolling this out in about 24 of the 57 Gavi priority countries. And these 24 countries are the baseline primarily because they cater to about 80% of vaccine volume in dollar terms going to the countries from Gavi, as well as about 80% of the zero dose children. And these are the same countries which have the lowest EVM scores. So that is the reason we have embarked on this digitization journey, at least in these 24 countries. Of course, not leaving the others, whichever want to go in and do digitization. So that is going to be an important aspect as we're planning our work in supply chains. The other aspect that is around strategic planning, and this again is not only looking at strategic planning from a national level, but also ensuring that planning that we are doing, the strengthening that we are doing for National Logistics Working Group in bigger countries is also going down to the subnational working groups as well. And it is linking well to the data that is going to come in, and looking at forecasting exercises, so building the forecasting toolbox that UNICEF, WHO has developed. How do we roll that out in the countries going forward in the next 2 to 3 years? And that should include forecasting of vaccines not only for the normal population, but also cater to the populations which are consistently missed, be it the zero-dose children or the displaced populations or populations affected by conflict. Because many a times we do not forecast for those communities and populations, and hence we are where we are. So looking at strategic planning from an equity angle is going to be very important, and that's the focus that we are putting together from the planning perspective. System optimization and segmentation, again, an important aspect. And for us, system optimization and segmentation is not doing assessments after assessments, which do not really get implemented. What we are talking about is last mile delivery of the vaccines, and the vaccine should really be available at the last mile. The work that Olamide mentioned around drive is an important component of that. But we're also looking at how do we bring in private sector into this whole space, where you are able to deliver the other commodities through the private sector, but vaccines are not reaching these last communities. So important for us to really look at the supply design, but design with a purpose, not just doing another assessment and leaving that behind with no action. So from that perspective, we are looking at system optimization and segmentation. Capacity development and professionalization, again, an important aspect, enabling our healthcare workers, the supply chain professionals, to really be equipped with the right knowledge and the tools is going to be very important as we are looking at expanding the reach of supply chains, be it to the last mile or be it, as Anne mentioned, around new vaccines, be it the malaria, the HPVs and the rotas of the world which are coming through, and we are on a drive to really introduce these vaccines in more and more countries. Fundamental infrastructure will still remain an important aspect. We probably filled 50% of the gaps in infrastructure, and another 50% still possibly remains, more so at the last mile. In the last few years, through the CCOP platform, we have put in more than 70,000 fridges in the field. But what is happening to these fridges is going to be equally important, so that we are saving our investments in the vaccines and infrastructure, but delivering potent vaccines. So performance management of these fridges is a very, very important focus for us as we speak about fundamental infrastructure. So just not putting the infrastructure there, but ensuring that infrastructure is working well and performing to the best so that it can live the age and life of the equipment. And within this is, again, how do we reach the last mile? So bringing in innovations is going to be very, very important, be it through the freeze-free protected vaccine carriers, or be it through the active vaccine carriers, which are now coming into space, which extend the reach of supply chains. And we're looking forward to those innovations which can come in and help the worker who has to go out 2 days, 3 days into field to vaccinate those 100 kids. So how do you ensure that they have the potent vaccines? Smart integration and harmonization, again, an important aspect, that supply chains, we know our supply chains are working in silos many a times, you've seen that, but how do we integrate primary health care commodities into immunization supply chain and vice versa is going to be important as we're going through. So all of this is very important for us in terms of investment priorities, and Gavi funding is really going ahead and trying to do that. Of course, through this, if we are able to achieve the impact goals of reach, availability, efficiency, resilience, responsiveness, and sustainability, that would help us to fulfill the goal of immunization supply chains that deliver vaccines to all the kids where they are, no matter where they are, in fact. So we are trying to do this through our investments, and the CVM approach, as was being mentioned, was given in the before this session, is how we are trying to deliver on this strategy. We cannot really do everything everywhere, so we have to prioritize, and that's where the CVM approach really comes in, that if we have to work across all these 6 fundamental investment priorities, what are the main things that we would like to ensure to reach the last mile? And we have taken a deliberate approach, identifying activities, identifying priorities which can help countries to really enable them to reach the last mile. So you would hear more about this during the next couple of days as well, but just leaving you with this, that Gavi's strategy is in terms of supply chain is really trying to address equity and efficiency in a sustainable manner through the rollout of CVM approach. Thank you.
Thank you, Karan. Now I would like to invite to the podium Kelly Hamblin.
Good evening, everyone. It is so exciting to see everyone here. I want to talk to every single person here today. Maybe not tonight, but at some point during the week. I really hope to be able to see all of you. This is such a great opportunity for us to all be in person and talk and share and learn, which is what I'm hoping the primary objective of this week is. So just having a lot of energy already from that and really looking forward to it. My name is Kelly Hamblin. I'm a senior program officer at the Bill and Melinda Gates Foundation, and I'm going to talk a little bit about taking maybe a higher level view of some of the work that we do at the foundation in support of immunization. We do this work. We support immunization in a number of different ways, through research, through development, through delivery. I'm actually going to focus most of my work, my conversation today on delivery. I'm also going to get off of my tiptoes. I'll be so much more comfortable that way. Thank you. Okay. Great. So at the foundation, we have made it our mission to find innovative ways to approach immunization challenges. We focus our possible impact and collect as much data as possible to track our progress. We tend to be very, very data-driven and laser-focused on that. So for our investments and for tracking that right now, what our goals are deaths averted, reduction in zero-dose children, and the eradication of polio. That's in alignment with Gavi and with IA 2030. So these are our team's goals and what we're trying to achieve by 2030 as well. We also believe that it's time for a new and different approach to address immunization, and that these challenges, that these are important challenges that we need to address to make sure that every child is reached. And that means better understanding reasons why we actually haven't been able to reach children, and adjust what we're doing based off of that better understanding. It includes innovating on how we deliver on vaccines in challenging settings and learning more about the gaps in the data that we have and trying to close those gaps. Is our supply meeting demand? Are we striving for operational excellence? Do we have the inventory where we need it? And is the cold chain there when it needs to be there as well? Is our planning accurate? Whether it's micro planning, whether it's supply planning, these are all questions that we need to be able to be really rigorously able to answer. Improving these processes and establishing operational excellence is primarily, that is where we are focused on improving where immunization is happening and being agile enough to identify where those gaps are and adjust and respond. That's for our supply chain, that's for how we plan for campaigns, it's how we are thinking about the people that we're trying to reach and understanding them better. So to do that, our work in immunization focuses on 4 key areas: reaching zero-dose children, accelerating HPV vaccine coverage, improving the coverage of measles vaccines, and strengthening routine immunization in high-risk areas for polio. So digging into zero-dose communities, which I'm sure everyone here knows, but we define that as areas where children haven't received a single dose of even the basic childhood vaccines. Recognizing that zero-dose children often come from families where women may not have also accessed other services like antenatal services, we see these as uniquely vulnerable communities that we need to reach. Sometimes it's not that they're difficult to reach physically. Perhaps it's other barriers. You see many zero-dose children actually only live within a kilometer of a health facility, actually most. For example, we've done a lot of research to try and understand what the specific details are that's driving some of these challenges. We've done in Karachi, for example, found out that many of the people that weren't getting vaccinated, it was an awareness issue. So we've scaled up some of the existing tools around social media and around community ambassadors to make sure that people are aware of services where they could get them. Separately, in southern Afghanistan, we've kind of learned that small changes to facilities actually encourage people to come to access health services more. Basic changes like ensuring that they had utilities like water and electricity, that they had bathroom facilities, that there were security guards so people felt secure. We know that we need to reach these children, and we need to go beyond our normal just immunization processes to get there, because they need a large set of services. And so these programs we need to be thinking about this in a really integrated way. So second, on increasing our focus on HPV vaccines, which are, of course, a highly effective vaccine against cervical cancer, one of the most common cancers for women worldwide. Cervical cancer is a disease that is driven by inequity. 90% of the deaths from cervical cancer happen in lower and middle income countries. We've actually seen some really incredible momentum around HPV coverage recently, introducing in new countries, et cetera. For starters, WHO's recent guidance on the 1 or 2 dose schedule for girls ages 9 to 20. A single dose schedule, as we were talking about earlier, is better because it's cheaper, it's easier to access because there's just 1 or 2 doses, really makes it easier for people to access. We're also really excited to see some recent launches for HPV, recently in Indonesia, Bangladesh and Cambodia just this month. Nigeria is actually later this month on October 24th. This is huge in terms of reaching large numbers of women. And then we've also seen the successful launch in the Global Scientific Declaration on Cervical Cancer Elimination that calls for urgent action to increase access to HPV vaccination for a brighter future for women and girls, so they don't have to live in fear of getting cervical cancer as well. There's already been 30,000 signatories to date, which is just another great example of the momentum. Third, we're committed to stopping outbreaks, particularly for measles, which is one of the most contagious viruses in the world. In response, we've been supporting partner efforts to strengthen routine immunization systems, conduct timely, high-quality vaccines. A lot of that is around planning, making sure that doses are where they need to be, that we've got really strong, solid microplans in preparing for those vaccination campaigns. The foundation has also been a long supporter of other innovations like microneedle array patches to make vaccines easier to administer, which we were talking about earlier. We see lots of opportunity there in terms of reducing the cold chain requirement, for making the experience of a vaccine, both for the child and for the caregiver, much easier. If a shot isn't painful, it is likely to scare off fewer people when they're hesitating. And then finally, we are highly committed to protecting every child against polio. Polio eradication has long been and remains one of the foundation's top priorities. We're a big supporter of the Global Polio Eradication Initiative. We're also working to improve the quality of campaigns like for measles, where polio virus continues to present a risk. That includes supporting door-to-door efforts to increase immunity. We understand how important a gender-sensitive response to service delivery is, and in particular, that example for delivering services door-to-door. Many of them are women, and that's actually, we see as a really promising approach, because often women are more approachable, they could be more trusted, they may be more likely to be accepted into the home if it's only a female caregiver who's at home. So really kind of prioritizing the gender-sensitive and gender-responsive approaches to providing service delivery. We also see the importance of working with partners to integrate vaccination of polio into essential health services. For example, in Somalia, where there are many districts who've had no health services for close to decades, we're actually bringing together our work in polio and zero dose and in measles all together, because we understand that all of these initiatives can't be thought of in silos. They need to be integrated and working together. So our North Star at the Bill and Melinda Gates Foundation is to ensure that everyone has the opportunity to lead a healthy and productive life. And the last few years have shown that vaccines are more important than ever, and yet we're operating in an environment where communities have lost trust in their health system. We're eager to see innovative ways to addressing this and seeing immunization leaders, new and growing immunization leaders step in with new ways and new partnerships and working together to solve these problems. And gatherings such as TechNet like this are that's a breeding ground for those ideas. And so I want to encourage everybody to listen hard to each other as we're talking about all of our work. Constantly be thinking about the people who we're trying to serve when we're having those conversations, and look toward shaping the future of our immunization programs together. Have a good week. Thanks.
Thank you, Kelly. Now, I would like to invite to the podium Daniel Salas.
Good afternoon. Thank you very much for this opportunity. I'm the regional advisor for PAHO and Road, in case that post doesn't sound familiar. So we're going to talk about first challenges and what is needed regarding leaving no one behind in terms of immunization. And we can talk about some of the current challenges that we have in the Americas. And of course, this is not like a comprehensive, list of all of them. But for example, we need the most important probably thing that we can talk about here is the political support, because that political support brings financial sustainability, brings integration, brings constant, resources injected to our program on immunization. But the thing is that we have a lot of competing priorities at the same time, as some of my colleagues have mentioned, not just within the health sector, but outside the health sector. There's this problem of vaccine hesitancy that is linked to probably resistance to, the status quo, what we have accepted for many long time. There is a trend to deny what we have already known about this. That we need to combat misinformation. We need to be ahead of these anti-vaxxers and use social participation, leaders, social resources in a more effective way. The healthcare workers are overburdened right now. There are more vaccines, there are other topics and administrative work, and sometimes even there is a lot of demanding from, the higher levels. Bring me this information. I need more variables. I need more, more guidelines to learn. So we need to really learn to put ourselves in the perspective of the frontline healthcare worker to really try to simplify their works. The lack of, we have information systems that sometimes are outdated or not working properly. And there's a lack of interoperability as well. We are in an era where our information systems should be able to really find easily the unvaccinated, but we are not yet there in a more broad way. Many vaccines to be introduced in a short time frame, and we are aware of these. A lot of interesting vaccines are coming, but there is lack of prioritization. The cost effectiveness studies are not there necessarily in many cases. And for example, here in the Americas, we have a lot of middle-income countries, but we don't have, the strong support to introduce vaccines from external stakeholders. So we have budget constraints with no external support. There is the constant need to train healthcare workers, but it is important to train them not just to know the vaccines, but to really be empowered to convince the people that vaccination is important even today, because there is a lack of risk perception because of the same success of the program in many cases. And of course, we need to adapt the system to reach people, because sometimes both parents are working. The visit to houses or to reach the people occurs mainly from 7 a.m. to 4 or 5 p.m. And people are not in their home. So we need to really rethink how to reach the people. So what we need inside the immunization program, just to have like a briefing about the last slide, we need strong governance, partnership, integration. We need the political leaders to be convinced that this is a cost-effective program, not within the health sector, but for the whole society. We need to have information systems, logistics, and these effective vaccine management, continuous quality improvement. This is not just a matter to revisit every single year, but constantly. The timely and effective communication and the approach to the misinformation, and we really need to have this behavioral change incorporation of tackling this misinformation. The VPDs and the supposedly attributable adverse events to vaccination surveillance integration. And also we need the personnel constantly trained and empowered to positively advocate for vaccination. So what is the region of the Americas working on right now? We're working towards the regional specific targets like improving the management of the EPIs through training and workshops. And right now we have 7 available, 6 upcoming. We're working on including the NITEX in the decision of making process to strengthen the operations of EPI. And we have formed here the regional NITEX network in the Americas, and we're having this second meeting in December. We're working on strengthening the infrastructure of the EPIs, bolstered by COVID-19 vaccine rollout, which of course was, very, very demanding. And we're including the electronic registers, the cold chains, the SAVI surveillance network, and others. And we're also working on integrating the COVID-19 immunization into the EPI, which as of today, we're not totally sure about what is going to be the seasonality recommendation, but of course we need to accept that the SARS-CoV-2 is a virus that's going to remain with us. So we're working on that too with the EPI monitoring performance tool and dashboard and other important things. This is I'm sorry because I didn't pass the slide, but this is for the last things. And this is to show that we have been working with this implementation of the Immunization Agenda 2030, and we have this important resolution that the governing bodies adopted in 2021, which is called Reinvigorating Immunization as a Public Good for Universal Health. And we have been working to develop this new regional immunization action plan, which is aligned to the immunization agenda, and this resolution. And this year we have been working on the definition and validation of the objectives, the indicators, and the lines of action by the 3 levels. And now we're at the point where we have this action plan validated and almost ready to start, the implementation and the follow-up for the next year. And of course, we have been working with, key activities to support the Big Catch-up. For example, you can see here the follow-up campaigns where we have reached more than 36 million children vaccinated against measles, rubella, and polio for the period 2021 to 2023. And those red countries are the ones that, of course, were implementing the vaccine, the rollout of the COVID-19 vaccination, and that impossibilitated to reach higher percentage. And of course, we have our, flagship activity where we put a lot of effort, the countries put a lot of effort to increase the vaccination week in the Americas. And this year we had 55 million people vaccinated with 60 million doses applied, and you can see the numbers there. And we are already planning the next year. You know, this was the first vaccination week in the region that originated the World Vaccination Week. And so some of our next steps is the implementation and the follow-up of this regional action plan for the immunization agenda. We are working hard to standardize this new performance monitoring tool, which is graded. This monitoring tool is linked to a next action plan that is going to address the weak points that we're going to find with this monitoring tool. But at the same time, it is based on a process design so that for each item, we can see which is the state of the country, you know, in the progression towards a fifth maximum level of correct implementation or good implementation. And of course, we're working on the implementation of strategies and modern tools to find the unvaccinated and increase the coverage. And regarding this, we're having these workshops and a guide for the countries to continue working on implementing localization tools for, you know, to find in a more easily way the unvaccinated. And it is important just to mention that here in the Americas, I know that it has been mentioned by Dr. Jarbas Barbosa, our director, and by UNICEF as well, that we have now 83% of DPT-3 coverage. Last year, I mean, 2021, we had 81%. This is not common for the Americas. We are not we're not used to get to be there. So we really need to, you know, continue working to get the 90 or the 95%, which is our goal here in the Americas, and of course to look for the introduction of new vaccines. Thank you very much.
Thank you, Daniel. We thank the presenters for their insightful presentations, which have provided us with new ways of managing the programs. Now, I hand over the chair for the next session. Thank you so much.
Thank you, Nora, and this session. Let's upload again for the exit. Yeah, and then